I just want to go over patient positioning with you. So hopefully this video will give you some clarity on how to position our patients. So the first thing we have to do is raise the bed to a comfortable working height, right? So you have to preserve your back. Always raise the bed to a comfortable working height. Good morning, Mr. Smith. How are you? All right, so the bed is very comfortable. I'm going to lower my side rail. All right, so the first position that we're dealing with that we see Mr. Smith in is supine position. When they're lying flat on your back, the pillow is under the head, neck, and shoulders, okay? Supine position. We can also elevate the feet, okay, to prevent breakdown. Oops. All right, we elevate the heels, right, to prevent foot breakdown of the heels, okay? So we float the ankles. So for supine position, the pillow is under the head, neck, and shoulders, okay? And we float the ankles, or we can use a footboard or high top sneakers, okay? All right, so let's remove the pillows and let's get with our next position. Okay, so remember when you are repositioning patients, always remove all of the pillows before you get started and make sure that the patient is pulled up to the head of the bed before you reposition. So our next position is going to be dorsal recumbent. Dorsal recumbent position is a position that's commonly used for perineal care. Okay, so for the patient, we are to flex their legs this way. We flex, okay? We always provide privacy. They open their legs to 45 degrees. Okay, and they are to flex this way. Okay, so this is dorsal recumbent position. The patient head has the head of the patient's head. There's a pillow under the head, neck, and shoulders. The legs are flexed open, and we always provide privacy. So with this is the position that's commonly used for Foley catheter insertion and also perineal care, maybe a vaginal exam, okay? All right, so that is dorsal recumbent position, okay? The next position we're going to do is semi-Fowlers position. Semi-Fowlers position, the head of bed is elevated. Sorry, got a remote thing here. I have to lift the head of the bed up. Okay. 15 to 30 degrees is semi-Fowlers position. Okay. Pillow is under the head, neck, and shoulders. And we float the ankles. Okay, to prevent skin breakdown of the heels. We always float the ankles, okay? Especially if patients are non-ambulatory or they can't position themselves well in bed. We provide pillows for comfort on both sides, on both arms. Pillows for comfort. Also, we give them hand rolls. Hand rolls. You can actually get a washcloth. You roll it and put it in the patient's hand, okay? Okay. This is commonly used for patients who have had a stroke, okay? To prevent contractures of the hand, all right? Okay, so here is semi-Fowlers position. The pillow is under the head, neck, and shoulders, okay? There are pillows under both arms. We float the ankles to prevent skin breakdown on the heels. We would also provide a footboard or high top sneakers, okay? And also we have hand rolls to prevent contractures of the hands, okay? So this is semi-Fowlers position. The head of the bed is 30 degrees. Now we're gonna go into Fowlers position. So remember, we have to always remove every pillow before you reposition the patient. Remove the hand rolls, remove the arm pillows. Okay, the pillow is under the head, neck, and shoulder. I want to ensure that the patient is all the way at the head of the bed. So now for Fowlers position, I'm going to raise the head of the bed 40 to 60 degrees. Because if you don't ensure that the patient's head is all the way at the top, when you raise the head of the bed, they'll feel like an uncomfortableness in their abdominal area. So you want to make sure that they're at 45, okay? to 60 degrees for Fowlers position. So this is pretty good for Fowlers position. We always want to make sure the side rails are up for safety. So for Fowler, let me just make sure he's all the way up. Okay, sliding down. All right, so for Fowler's position, it's also a position for comfort. If a patient is receiving tube feeding, we always want to make sure that their bed is elevated at least 30 degrees, okay? So pillow under the head, neck, and shoulders. We float the arms for comfort on both sides. Okay, Fowler's position. And what are we going to do next? We're going to float the ankles, right, to prevent breakdown of the heels, okay? Footboard, high top sneakers to prevent foot drop, because if you don't support, their feet will be like this, right? So we always want to make sure their foot is supported. Footboard, high top sneakers, okay? And also we provide hand rolls for some patients. Hand rolls are only for patients who have had maybe CVA or stroke, right? Okay. Usually physical therapy provides hand rolls, but if they do not, we can use towels. We roll it up and we put it in the patient's hand, okay? So this is semi-Fowler's position. All right, so now we're gonna go to, I'm sorry, this was Fowler's position, I'm sorry. All right, so now we're gonna go to high Fowler's position. So remember, anytime we reposition a patient, we always want to remove the pillows before we reposition them. All right, Fowler's, this is Fowler's. We're gonna go to high Fowler's position. I made sure that the patient's head is at the head of the bed. All right, so let's move up to high Fowler's position. High Fowler's is 90 degrees, 90 degrees. So all the way up. This is the position that's commonly used for eating, providing oral care, okay? Any sort of examination of the oral cavity, we want them in a high Fowler's position if the patient can tolerate it, okay? Here, the patient is sitting at 90 degrees, okay? This is the position that you want them in when you are feeding them. So we're gonna provide pillows for comfort on each side. Okay. We're gonna float the ankles, right? The pillow can be open if you want it to be. It doesn't have to be folded like I had it. It can actually just be this way, floated, as long as their ankles are not, or the heels of their feet is not having friction against the bed, because this area of the foot breaks down. So we want the ankles to float, and then footboard or high top sneakers, okay? Also, we're gonna provide hand rolls, only when necessary, hand rolls, okay, to prevent contractures of the hands, okay? So high Fowler's position, okay? AIDS patients who are having some sort of respiratory difficulty, sometimes they prefer sitting up in high Fowler's position, okay? So that's our high Fowler's position, which is 90 degrees. Now we're going to put the patient in, let me see. I've already did dorsal supine, but I forgot to do one thing with dorsal supine position. So let me do that, and by providing some trochanter rolls, okay? All right. So the other one, we did supine position. We did dorsal recumbent for Foley insertion. We did semi-Fowler's 30 degrees, Fowler's 40 to 60, high Fowler's is 90 degrees. Okay, I think that will cover. Let me lower the patient's head and let's apply trochanter rolls. All right, so we're gonna lower Mr. Smith down and we're gonna provide some trochanter rolls. So this will be dorsal supine position, okay? So let's do dorsal supine. We did supine, it's just flat, right? We're gonna do dorsal supine position. So the patient, of course, is in supine position. And dorsal supine position requires several pillows and trochanter rolls, okay? So let's get started. The patient is already at the head of the bed. Yikes. Okay. Pillow is under the head, neck, and shoulders, okay? So we're gonna provide a lumbar pillow under their back if necessary. We're gonna apply a pillow under their lumbar region for support, okay? I'm gonna Apply the pillows for comfort on both sides. Okay. Sorry, I shouldn't have did that first. What I should have did first was apply the trochanter rolls, right? Trochanter rolls, this is a makeshift one that I did, but trochanter rolls are weighted. And what they do is, you know where your trochanter is, right here, right? Trochanter rolls prevents the leg from externally rotating out this way. So a trochanter roll maintains alignment, okay? So we apply our trochanter roll laterally, right at the trochanter, and it prevents external rotation of the hip. Okay, so we apply our trochanter rolls on both sides. Remember, trochanter rolls are weighted, meaning that they have weight to them. Some of them are 5 pounds, some are 10 pounds, but it prevents external rotation of the hip. Okay, so we want everything to be in alignment. So we have our trochanter rolls in place. Now we can provide the arm pillows for comfort. Okay, arm pillows for comfort here, right? Okay, now we're going to float the ankles. Pillows under the ankles to prevent skin breakdown. Right. We float the ankles, all right, to prevent skin breakdown. Footboard, high top sneakers. And then we apply hand rolls. Okay, this is a very comfortable position for some patients, right? All righty. All right, so again, for dorsal supine position, pillow is under the head, neck, and shoulders. Trochanter rolls on each side to prevent external rotation of the hip. We have pillows for comfort under the arms. We float the ankles, and we will provide a footboard here or high top sneakers to prevent foot drop, okay? And then we have hand rolls to prevent contracture of the hand, of the fingers, okay? All right, I hope this helped you. We do have another position, which is lateral or Sims position. It's kind of difficult to do this one on this Sims because there's some missing things on it. So, but okay, thank you.